Thank you, and welcome to everybody. I think these sort of annual reviews are always really interesting, and I think this year is going to be especially interesting. And I mean that in kind of a bad way, like when your doctor walks in with test results and says that your test results are interesting. That's kind of what we're getting into today. So it's not just me presenting. I'm joined by my Siegel colleagues here. My name is Eric Miller. I'm an actuary with the National Health Practice here at Siegel. My primary responsibility is the health actuarial models. Joined by Jason Jossi, who's another actuary in the National Health Practice, who focuses primarily on analytics, and Matt Nguyen, who is a data scientist and a PharmD with extensive experience using both. And then finally, Dr. Sadna Paralkar, who is the lead of our clinical consulting practice here at Siegel. And this is kind of the approach we like to take when we analyze trends, when we analyze the industry over the year, is kind of a mix of, real clinical knowledge, pharmaceutical knowledge, data science, and whatever actuaries bring to the table, kind of get that whole holistic view of what's going on in the industry. So this is what we'll walk through today. And for anyone not familiar with the format, this is kind of a mix of responses to our industry survey, which is plan sponsors, vendors, kind of getting the general sentiment of the industry, and then some specific findings that we dig into with our own data, where we kind of get a little bit more in the details, in the weeds. And then at the end, we'll come back with some common cost management strategies, which again is a mix of the survey and kind of our own thoughts. And then we'll finish with everybody's favorite topic of obesity. And then questions at the end, of course. So let's dive right in. We have a pretty dense set of material today. And so this is kind of the big high level here. And note that for 2017 through 2024, you're seeing the actuals. So that's why you see this big, the COVID disruption for these years. So these are actuals through 2024. And then 2025 is what was projected for 2025 last year. And then 2026 is what people are projecting this year for 2026. So actuals and then projected. And of course, the big thing that stands out here, and one of the main themes for the discussion today, is this big increase from 2025 to 2026 for medical. I'm kind of focusing on PPO, but you kind of see the same pattern. But going from 7.9% to 9.3%, that's a very material increase for something like this. And you'll kind of see this on the next slide. But typically, people are pretty conservative in responding to this. So you don't tend to see big swings in the projection or big swings in projected industry sentiment. And so this is a very, very significant result of the survey, this big increase. And I would say that sentiment is kind of how I think about this. So it's not that the trend will be 9.3% or you just walk away, it's 9%, something like that. But really what it really reflects more on people's feeling of 2026 relative to 2025. So while the 9.3% is not necessarily going to be like the number, you could really draw a lot of conclusions from the fact that, going from 7.9% expected to 9.3% expected, that's really the key finding that I take away from it. And then on the drug side, going from 10.2% as the last actual in 2024, and drugs have always been running pretty hot, or not always, but last several years has been running pretty hot. And then the projected last year, 11.4%, and then down a little bit to 11%. There's a mix of factors on the drug side. So I don't read too much into this aside from the fact that the sentiment isn't shooting it way up or bringing it way down. And it's important to think about the context for this number. We're kind of in an interesting time in the prescription drug space in terms of the varying ways that people are covering or not covering GLP-1s. So these numbers are going to reflect the book of business and the typical coverage patterns of whoever is responding to the survey. So this you'll see later on when we get more into the drug side, how much this can impact trends and impact the outlook based on whether plans are covering GLP-1s for obesity and how they're covering those, how tight the coverage is, how loose the coverage is. So just keep that in mind when you're seeing the survey results, that this may not necessarily apply to your plan, or it may not necessarily apply broadly, that this is just reflecting the people who responded to the survey. So it's kind of a, keeping it kind of steady. So this next slide here, we get into, this is that same actual number through 2024 for the PPO, and then we compare it to what was projected. So this is the initial expectation of all of those years. And you can see what I said before, how it tends to be pretty steady. You don't tend to see these really big jumps. The actual experience, of course, is a little bit more volatile. And of course, nobody was projecting 2020 in advance, but you see this big COVID disruption, and then you see this very steady projection line. In 2024 was a little bit unique, again, ignoring COVID, in terms of the projected or the actual being above projected. Typically, there's a little bit of conservatism in these projected numbers, a little bit of space here as we go. And in 2024, the actual came in just a hair above projected. And I kind of expect that's going to be the case when we see this again next year and look at 2025. I think we're going to continue to see the actual be above projected, and probably by a more comfortable margin. And then at the bottom here, we show the consumer price index, and there's always a healthy space. Historically, they tended to kind of move together, but not so much in recent history. And of course, there's kind of a long delay, a long lag effect in terms of inflation making its way into driving up prices in healthcare. It takes time for prices to go up in healthcare. And so I think what we're starting to see now is a little bit of that effect, but also some more recent effects, kind of mixing in. But you see inflation picked up for a bit there, if anybody remembers those years. And then now is back to maybe a little bit more of a normal, still a little high, but kind of normal. But there's always a pretty big gap here. And so part of the message here is there's a lot more going on, a lot more driving costs here than just inflation. And that kind of brings us to this next slide here, where we get into some of those and unpack it a little bit more. This is a big list. I'm not going to go through everything on this list. I'll just touch on a few things here. And we already mentioned, inflation on the last slide. And I do think that's the primary driver of what we're seeing now, is these kinds of cost effects, these kind of price inflation effects. We're in an area, or we're in a moment of high uncertainty, coming out of a period of high inflation on the healthcare side. So there's a lot of spots within the healthcare ecosystem, be it providers or insurers or point solutions manufacturers, everybody except your actuarial consultants, who, at this time are looking at either regaining margin that they might have lost recently, or are looking to build margin to protect against, future uncertainty. So this really isn't a time to just kind of sit on your hands. This is a time to try to get price increases if you can get increases, and try to protect margin. And I think that's kind of where the industry is at right now. And I think that is a key driver of what we're seeing today, and especially of that sentiment looking from 2025 to 2026. I think this is a lot of what people have on their minds, which kind of fits in with this one down here on regulatory changes. There's been a lot of activity there. And so I think this is on people's minds as well. Certainly, the quote unquote, one big beautiful bill. There's a lot of articles, a lot of coverage on how this might affect the system broadly, outside of the Medicaid population or the Medicare population, but just the cascading effects, the downstream effects of cuts to Medicaid or other changes. This is certainly on people's minds and something to watch, but also things like No Surprises Act and out-of-network or surprise coverage going to IDR and those sorts of results. So there is some regulatory effects occurring in trends. And then the other one that I would highlight today as being kind of especially, in more recent years, is this consolidation. There's been a lot of articles and focus on this as well. The Society of Actuaries had a good macro study of this a couple of years ago, talking about the effects of provider consolidation on costs. And spoiler alert, it's not great news. It tends to push costs up. And then more recently, in more recent years, private equity has been very active in this space, again, kind of with the prices going in in one direction. But several other things are also factors, and they'll vary in emphasis at different points in time. And so this kind of leads into this next slide here of how your experience or one plan's experience might vary from these generalized numbers. So again, that 9% projection is kind of a median number, and there could be a pretty good range of what expectations are and what people are experiencing. And a lot of that is just going to be timing. Trends tend to kind of come in waves. So you might have a high trend year and then a low trend year, and et cetera. So what you're sort of seeing in these surveys is, and in our own experience, is kind of generalized data over time, kind of aggregating all of these different effects. But when you zoom in, it's a little bit more noisy for any given plan in one year. And of course, high cost claimants, these outlier events are a big driver of differences between plan experience and the generalized experience. Cost management programs can have a big impact, especially now in this era of GLP-1s. And so we'll talk a little bit more about that later. But there's many, of course, varieties of cost management strategies. Provider networks, is it a broad network? Is it a narrow network? What part of the country is it in? Not every health system or every network experiences these effects in the same ways, at the same magnitude, at the same time. So certainly certain parts of the country could see very different trends than other parts of the country. And then, of course, plan design features. So that's kind of a high level overview of what we were seeing in the survey. And now we'll dig in a little bit deeper, and Jason will kind of take us through some of this with medical and then get into what we see in our own data. Jason.
All right. Thanks, Eric. And hello, everyone. So I'll be taking us through our next few slides. We got one more that's based on the results from our trend survey. And then we're going to dive into, what our clients are actually seeing and look at our own actual data to give us some more insights on what's driving trend. So the first slide here, we're looking at what our survey respondents anticipate medical trends to be in 2025 and 2026 in the commercial market. So starting in the middle, PPO plans, these are typically the most popular plans, kind of depends on the region of the country, but for the most part, these are the most popular. Medical trends were expected to be 7.9% in 2025. For 2026, that expectation is jumping all the way up to 9.3%, which is a huge increase. We typically see much more stable results from this survey than what we're seeing now. So it's really indicative of the challenging time we're in the healthcare space. One thing to note here is the results we get for 2025 were actually provided by our survey respondents last year before 2025 even began. In reality, I think most plans are experiencing what we're seeing for 2026 here. Trends 9% plus for medical. That's kind of where we're at in healthcare right now. So the 2026 data here is really more indicative of the current environment we're in. We saw a few slides ago in that kind of 10-year period that PPO trends have not exceeded 7.8%, at least in that experience period. And now we're looking at 2 years above that amount, with 2026 being significantly higher than that. So it's a big challenge plan sponsors are facing right now. And that goes for other types of plans as well. On the left, we have results for high deductible health plans. Similar story there. Trends are expected to be 9.1% in 2026. And then all the way on the right for HMOs, trends are expected to be the lowest of the three at 8.8%, but that's still a very high trend figure, especially for a managed product like an HMO. So let's move on to our next slide here. And we're going to be looking at medical trends from our own data warehouse. We call it SHAPE. If you're not familiar with that, it's Siegel Health Analysis of Plan Experience. It's a data warehouse that contains detailed medical and prescription drug data across our corporate, multi-employer, and public sector base. So it's a good blend of plans in there from all over the country as well. So it's not region specific. But with this data, we're able to do a lot of analytics that provide insights into the quality of care members are receiving, what's driving healthcare costs, how networks are performing, things like that. So how to read this chart? There's a dark blue line that represents the median value or the 50th percentile across our client base in our SHAPE book of business. And then around that, there's the gray range, and that represents the 25th to 75th percentile. So Eric alluded to this a few slides ago, but that just kind of shows you the volatility and trend that any given plan might experience. There's a very sizable range we're seeing. Some plans are being more successful than others in terms of managing trend. Some just happen to have low trend because the year before they had really high trend. But that kind of gives you a better idea as to where the expectations really lie, as opposed to one data point. And then the last part of this chart I'm going to mention is that dotted turquoise line. That is the annualized trend rate since 2018 and 2019. So it's really only been about 5%. A lot of that was due to low trend, of course, in 2020. Also 2022 had a very low trend. But we're seeing that medical trends have been higher than that historical rate since about September 2023. We reached a low point at the end of 2022. By the end of 2023, we jumped all the way to 6.3% trend, which is, again, about normal for medical care, at least throughout the last few decades. But then by the end of 2024, we jumped all the way to 9.3%. So that's, the highest we've seen in 15 plus years. It sort of looks like they're leveling off towards the end there. I wouldn't expect trends to come down in the near term. There's a lot of catalysts, pointing towards upward pressure on trend, or at least maintaining this high trend level that we'll talk about throughout this presentation. One thing is the tight labor market, that has improved a little bit the last few years, but we're still seeing wage pressure, especially in the healthcare sector. I did see one stat recently that said that the wages for nurses has risen 27% faster than inflation from 2020 to 2024. And that was a period of really high inflation to begin with. So that's just indicative of the type of pressure that providers are facing. Of course, it wasn't an easy job to have the last 4 years. And a lot of hospital systems are seeing their workers fight for higher wages because of that. We're seeing hospitals continue to consolidate. The insurance market's been consolidated for a long time. So in a way, the hospital systems are really just catching up to that. But what this does is it strengthens their hand during contract negotiations with the payers. And we knew, when the rest of the economy was experiencing this really high trend, that we were going to start to see this in medical over the coming years, right? Because systems are involved in multi-year contract arrangements. They can't make adjustments overnight to reflect their increases in costs. So we knew this was coming, and it's really been showing up in the data, especially the last year or so. On top of all these cost pressures, we're also seeing utilization increasing. Demand for mental health services continues to climb. Regulatory changes are resulting in cuts to Medicaid that we know are coming. The overall impact on the commercial market from those is yet to be seen, but undoubtedly it will have some effect on the commercial market. So all these things are kind of causing upward pressure on medical trends. We're seeing that in our data, and we're seeing that in the responses from our survey participants. So let's jump back into, we got one more slide on our own data, and then we'll jump back into results from our survey. But we wanted to pick one area that's really been driving medical trends the most. And this really wasn't easy. The trends on the medical side right now are so pervasive, higher costs for cancer care, musculoskeletal, cancer screenings, just general physician office visits. They're all contributing. It's not like on the drug side where you can really point to GLP-1s or, psoriasis medications that's driving the majority of trend. On the medical side, it's just much more pervasive. But when we look at the last 5 to 6 years, no area has had a bigger effect on overall medical trends in mental health care. So that's really what we're looking at here. And again, this is all data from our Shape Data Warehouse, so it's specific to our clients. But on the left here, we show the percent of members that had a mental health related claim over the last 6 years. And in 2019, so prior to the pandemic here, about 22% of members were having a mental health related claim. And that's up to about 30% in 2024. So a huge increase. The exhibit, it breaks down that mental health utilization by generation. I mean, generally speaking, the younger people are, the more they utilize mental health care, which I'm sure isn't a surprise to most. But what we're seeing here is Gen A, which is the dark blue line on the top in the most recent years, at least. They're really driving both the cost and utilization in terms of mental health trends the most. We're seeing about 37% of Gen A had a mental health related claim in 2024, which is really significant, especially if you compare to the utilization of other types of medical care. That's a big chunk of that population. Over the last 6 years, the cost increase annualized for mental health treatment for Gen A has been about 16%, so significantly higher than that 5% historical rate we saw for overall medical. Some of this is due to improved access and awareness for autism. It's also heavily driven by ADHD. Our society's going to continue to grow more screen focused, so I expect that to be a big need within populations in the coming years. All generations are affected by things like anxiety and depression, but those areas can have a really big ripple effect through other areas of healthcare. We know that when members are battling a physical chronic condition and they also have one of these mental health conditions present, it greatly affects their ability to manage that physical chronic condition. And we can see it in poor outcomes, increased costs, things like that. So, this area is really expected to be a big focus for plan sponsors in the coming years. And it's going to be a big challenge. They have to grapple with how to improve the quality of care, how to improve access for mental health treatment, and then also contain costs, because this has been a significant driver. But with that, let's jump back to some of our survey results here. We're also shifting to the Medicare side here. So we're getting back to results from our survey for Medicare plans. One very important thing to note here is that the trends we're showing are for gross medical trends. And that's true on the commercial side too. It just has a bigger impact on the Medicare side. So this doesn't include changes to CMS funding or member cost sharing. And CMS funding really covers the bulk of expenses on the Medicare side. So what plan sponsors actually experience could be a lot different than that, just because of those other levers being pulled as well. But overall, we are seeing similar increases on the Medicare side, just to a lesser magnitude. Survey respondents are expecting a rise in trend for Medicare Advantage PPO plans from 4.9% to 6.2% in 2026. The middle areas for HMOs, again, Medicare Advantage HMOs, those are also expected to increase at 6.2%. And then on the right, the highest trend of them all for Medicare supplement plans or Medigap plans, those are expected to rise 7.7%. So very high on the Medicare side from what we've seen over the last several years. Also, what I want to point out here is just that the trend in the Medicare Advantage market specifically is just a lot different than the commercial market. It's highly dependent on star ratings, which if you're not familiar with those, it's essentially like an award system that CMS uses to evaluate the quality of care, and that ultimately determines the amount of funding an MA plan gets. It's also influenced by risk scores within the covered population. Again, what's been in the news a lot the last year or so is the federal government's crackdown on diagnosis coding that ultimately feeds those risk scores. So that's going to have an influence over trends. Any change to the star rating a plan might have, or risk adjustment revenue, that's all going to have a heavy influence on the net trend that a plan ultimately pays. So it's just something to keep in mind, if you're looking at Medicare trends and they're disconnected from what you're seeing here. Could move on to the next slide, please. All right, so again, we're looking at survey data here. Now we're shifting to ancillary benefits, so dental and vision. The four bars on the left are for dental plans. Dental plans are expected to have a trend rate of 5% in 2026, and that's true for schedule of allowance plans and also fee-for-service plans. And then dental provider organizations are expected to remain at 4.5% trend in 2026. And DMOs or dental maintenance organizations are expected to remain at 3.5%. So not as exciting as what we're seeing on the medical side, but 5% for dental is definitely on the high side from what's been experienced in the market the last 10 years or so. And then the right here, we have two trend figures for vision plans. The first one is schedule of allowance plans. These are expected to be somewhat stable, the 1% increase in 2026. And then all the way on the right, vision, reasonable, and customary plans are expected to increase 3%. And that's been pretty stable over time. 3% has been the trend rate on the vision side for many years now. So nothing really concerning happening there like we're seeing on the medical and the prescription drug side. But we're going to get into prescription drugs now. And for that, I'm going to pass it to Matt to take us through the next few slides.
And real quick, I'm going to answer one of the questions from the Q&A, that these are all allowed amounts. These are all allowed trends. So this does not factor in plan changes that may have occurred over time. I think this is a better way to look at it on level across the industry. So I just wanted to do that quick clarification. Matt?
Yep. Yeah, so I'll take us through prescription drug trends, starting first with the projections from our survey. And kind of along the same lines in terms of the trend, these are all before rebates as well. So, gross cost. So on the left here, you're seeing the projected pharmacy drug spends specifically for active and non-Medicare retirees. The survey respondents are projecting double-digit trend at 11.4% in 2025. And then no real mitigation forecasted for 2026, still sitting at that 11% mark as well. So forecast for especially meds and biologics, though, shown on the right, which includes Medicare retirees, is quite a bit higher. So our respondents are estimating trend here to be around 13.3% in 2025, and a little bit, but not major, reduction to 11.9% in 2026. However, like many things, this is really going to depend on, the use of biosimilars, which PBM may have, and so forth. We'll talk more about biosimilar strategies later on, but we do expect to see quite a few new products in this area. We'll see more insulins coming out, multiple sclerosis drugs, cancer drugs, various autoimmune disease drugs as well within that 1 to 2 year time period, and that will greatly impact your actual trend you're seeing for your plans. And then for biosimilars, just why the next big one that you should be seeing now in terms of uptick should be Stelara. So we can move now on to our next slide. And here I'm going to go over some specific data we're seeing in our Shape Data Warehouse. This setup is similar to the slide that Jason showed before for medical. And just keep in mind that, again, our client population is very different generally than the survey respondents. We're very heavy in that multi-employer and union group kind of population. But again, you're seeing here the rolling 12-month, prescription drug trend for our Shape clients for 2022 to 2024. Historical trend denoted by that dashed line is 8.8%, again, based on that 2018 to 2019 calendar year data. Our median trend for 2022 to 2024, shown by that dark blue line, has pretty much exceeded historical trend during the entire window you're seeing here. And as of December 2024, that median trend ended up at 13.7%. So essentially, half of the clients, in our Shape warehouse had trend well above the 13.7% mark. Now, looking at that shaded trend region, the 25th to 75th percentile, the gray area you're seeing, the 75th percentile actually ended up at 15.9% by the end of December of 24. So a quarter of our clients actually had trend at 16% or higher. It's just an astronomical amount. The big question, though, with drugs is how has anti-obesity medication coverage, specifically GLP-1 coverage, impacted these trends? And we'll look at this on the next slide. So on the left here, we're showing you a little bit more historical data from our Shape warehouse beginning in 2019. You're seeing, the median trend there and the trend range. You can see it just incrementally increasing, every year from 5.8% in 2019 to 13.7% by the end of 2024. On the right, though, you're seeing a slice of our trend based on clients who cover AOMs, specifically really those GLP-1 anti-obesity medications, versus those that do not. And, just as a reference point, about 60% of our clients or so a little over half, cover weight loss GLP-1 medications. So a pretty good split. We've got pretty good robust data here in terms of having, two comparison groups. Now, just obviously you have to keep in mind that AOM coverage can vary greatly in terms of utilization management programs and other restriction and gatekeeper programs in place. So whether, a client requires members to go through a vendor to get coverage, whether it's restricted to a specific group, whether there's step therapy and so forth, that can all change, how, much members actually use these weight loss therapies. But early on, you can see that, for clients who cover AOMs, which is shown in that purple line, early on they had trend about 1 to 2 percentage points higher than those that did not, 7.6% versus 5.5%. However, this started to increase quite a bit beginning around 2022, and actually rose to 14.8% by the end of 2024. This is about 5 percentage points, 5.5 percentage points higher than clients not covering AOMs, shown in green, where their median trend ended up at 9.2% for comparison. So a massive difference. If you were just to hypothetically apply the median trend each year, let's say a client had $100 PMPM by the end of 2028. And if you took that median trend each year, by the end of 2024, you're talking about a difference of about $20. So $159 PMPM for those clients that didn't cover AOMs versus $178 for those that do. So a massive amount. And $20 PMPM, some clients have total diabetic spend of $20 PMPM. For clients not covering AOMs, they saw their trend spike around that 21 to 2022 time period. And that's partly due to updates to those diabetes guidelines by the ADA, and also kind of, new therapies coming out that were easier to use. Specifically, Trulicity and Ozempic came out around that 2021 time period, a little bit earlier. And they, essentially allowed people to use drugs on a once weekly basis versus previously things like Victoza and Byetta were once a day or twice a day even. And then, this high trend was sustained and enhanced with Mounjaro's release in, mid 2022. And Mounjaro's, big claim to fame at that point was the robust weight loss also associated with it, not just diabetic control. On the AOM side, we see that rise begin a year later in 2022, and that's really when Wegovy had notable availability. It came out around June of 2021, but full availability really was towards the end of the year. And also, plans were deciding, or PBMs were deciding whether to cover it or not. And then Zepbound was introduced at the end of 2023. Wegovy had an enhanced indication added on for cardiovascular risk reduction in early of 2024. So that trend pace really only increased, which is you see that dramatic rise. These drugs will probably continue to gain indications. We saw Zepbound get obstructive sleep apnea at the end of 2022. And then MASH, a liver condition, was added to Wegovy just last month. So, these new conditions, in addition to the, plethora of new investigational indications, such as with substance use disorder, all these, indications, we just expect AOMs to continue to drive trend wherever plans continue to provide that coverage. So next, we're going to move, beyond GLP-1s. So
sorry, Matt, there's a few questions that are relevant to that slide I just want to address real quick.
Sure.
The first one, I guess this is true for any drug trends we're showing, was our RX trends shown here, net of rebates. No, they're gross of rebates. So we're not removing rebates from those amounts, and either are our trend survey participants. Another one was, so the trends are with and without GLP-1s for weight loss. That's referencing the chart on the right here. And plans still cover diabetes in this example, and that's true. Yes. So so all plans included there cover GLP-1s for diabetes. It's just the purple line also covers it for obesity management only, whereas the green line only covers it for diabetes. Hopefully that answers the question.
Yep. Thanks, Jason. And just to be clear, it's plans to cover that, AOM GLP-1 coverage. We're not just saying we're taking the GLP-1 coverage out of it. So it's two different coverage scenarios. In this case, we're, again, splitting out trend, but based on the other indications contributing to prescription drug trend. I think the slides went away, Eric.
I didn't do
back
anything.
up. Thanks.
Okay, you're back.
Okay. So now you're seeing the other indications contributing to prescription drug trend, but we're slicing it still out by plans who cover AOMs and those that don't. So, on the top there, while AOMs, continue to make up nearly half of that 14.8% trend you saw for plans covering them, diabetes continues to be, a pretty big driver in both scenarios. But really, the key area to focus on outside of, AOM coverage is psoriasis. That's really one to keep an eye on, as it's the leading trend driver for plans that cover or that don't cover AOMs, and the second highest for clients that do. And in either case, it's over 2 percentage points that is contributing to trend. And one of the reasons we're seeing, big trend increases here is partly due to the effectiveness of direct-to-consumer advertising, particularly with Skyrizi and Tremfya, which really are, the two biggest drugs, at least for our book of business in this area. We're seeing, much higher rates of psoriasis diagnoses in our warehouse, so people are going to seek care more readily, whether that's it could be most likely advertising driven, and also the drug therapies are much more expensive. So, yes, we can focus on the specialty biologics, which typically carry, a cost of $10,000 per month or more. But we're also seeing much higher adoption of non-steroid agents as well. We're seeing non-steroid creams and gels. These can cost in the range of $500 to $1,000 per month. Drugs like Zori, for example, compared to traditional generic steroid creams that may be $50 per month or less, right? And then on top of that, historically, you saw a lot of medical treatment options available, and these are generally low cost, but we're seeing a decline of their usage as well. And I think, Sandhya, would you like to add some thoughts? I'm sure you got some opinions of this.
Yeah, so psoriasis is not a new disease. Psoriasis is not a fatal disease, but so it's not like the people are more people are getting psoriasis. That's not the case either. It's just the new drugs that are in the marketplace are, and correct me if I'm wrong, Matt, but they are $10,000 a month types of drugs. So these, ask your doctor about Skyrizi, Rinvoq, Taltz. These are really expensive drugs, and that campaign works. So what I maintain here is you, the plan sponsors, are victims of for-profit medicine. And the reason I say that is because, like I said, psoriasis is not fatal. It's not new. The treatments, the old treatments of psoriasis still work. Corticosteroids, vitamin D analog, light therapy, methotrexate, cyclosporin. These are all old drugs. They are generics, and they work for 80% of the psoriasis cases, but they don't give that instant relief. So because it has that ugly presence, the plaque psoriasis, they do ask their doctor about Skyrizi. The doctor prescribes. Both of them do not care about that $10,000 a month expense, and you end up paying for that. And it's not just psoriasis, by the way. There is skin disorders, which is now here in the pink here. Eczema is another great example of that. There are many, many expensive drugs for eczema now, like Dupixent, Ebglyss. There are ads for all of them. Traditionally, eczema can easily be treated with heavy-duty moisturizers and heavy-duty steroid creams. But because of this awareness that the pharma companies have created, they immediately jump to these drugs, and the doctors prescribe and you pay for it. One of the solutions that can be administered is step therapy for all of these. Nothing stops you from doing step therapy for psoriasis or any kind of skin disorders. And all of the treatment that I mentioned earlier should be tried before allowing somebody to have these really expensive Skyrizi type drugs. That's all I wanted to add, Matt.
And I'll jump in with a quick clarification from one of the questions. Is that rebates have also been increasing. So that is some of the offset, is that rebates have been changing during this time as well. And then importantly, what we're showing here is just what's in claims data. So there may very well be members that are taking GLP-1s directly, which we wouldn't have any way of knowing that they're doing that if it's not going through the claims data. So you might see some effects of that without seeing the drug itself in the data. And then lastly, if you're on from one of the drug companies, her email is speralker@siegelco.com with any comments. Matt, back to you.
Yep. And there's another question regarding the difference in the diabetic percentage, the 1.4% you're seeing for those that don't cover versus the AOMs versus 0.6% that those that do, and whether it's some of the mask off-label usage there. And we've definitely seen that. I think when we first did our analysis a couple of years ago, back in the end of 22, early 23, we were seeing about a third of people that were using anti-diabetic GLP-1s that did not have a diabetes diagnosis, so it's definitely some potential off-label usage there. So definitely keep in mind, what the prior auth criteria looks like, for your clients.
I think there's one more.
Yep. Oh.
There's one more question I was going to address, I think, for this slide, and then we've covered them all for this specific slide at least. So this period is the trend in 2024. So this is just looking at the 2024 over 2023 cost increase. The totals for the top bar that cover AOMs and the bottom bar that do not cover AOMs, those equal exactly to what we saw in the previous slide. So this is just showing you what makes up the trend difference there, which is obviously the obesity management's the big one.
Yep. And then actually there's a new question that's asking about, seeing the psoriasis increase, or is part of the psoriasis increase because it's indicated also for, IBD and things like that. Yes, all these autoimmune drugs and so forth, Humira, Stelara, Skyrizi, blah, blah, blah. They all have multiple indications for sure. But we've also even looked at isolating drugs for psoriasis for people who only have a diagnosis of psoriasis. And we've seen substantial growth there as well.
Right, let's hold off on other questions until the end. We're getting a little behind. I want to make sure we keep up with everything. Did you have more stuff on this one, Matt, or?
Yep. Just the last thing I want to talk about, in terms of biosimilars, just keep a close eye in this area, especially because Humira was the first real big test that we saw, and AbbVie, the maker of Humira, now is heavily promoting their other drugs like Skyrizi. So that's also part of the reason why you're seeing a big boost in psoriasis, indicated drugs. All right, back to you, Eric.
Yeah, so now we'll get into some of the cost management strategies. This is also from survey respondents and from ourselves, our own expertise. But real quick, just to level set, we like to kind of take a broad macro view of what's going on in the labor economy, and I don't think too much of this will be very surprising. There's a great deal of uncertainty. We've already talked about that. There was a period of time when everybody was changing jobs. We're in a little bit of a different time now. There's a lot of challenges, there's a lot of pressures, but survey after survey continues to show that health benefits are a top consideration, for people making employment decisions, for attracting and retaining talent. And it still continues to be true, our experience, that plan sponsors try to absorb as much of those increases as they can. They're very hesitant to just push costs off to their plan members. And then certainly with high trends, you tend to see a lot of interest in point solutions. Point solutions have not gone anywhere in the last year, and other issues in attempting to address inequalities and focus on social determinants. That also continues as well. So from the survey, this is not our ranking, this is the survey ranking of the top 5 cost management strategies that people are exploring. And we'll kind of spread this out a little bit. I'll talk just real quickly about networks. This is, when trends are really high, 9% or heading into 9%. I think plans tend to look for hard dollar savings in their network. They're not looking for something that's going to pay off 3 to 5 years from now, but really wanting something that they can take to the bank in the near term. And the best place to get that is just right out of your network contracts, reducing unit costs, optimizing provider steerage. And there's a lot of new information out there that allows plans to do that, be it transparency data or other things, or point solutions that focus on those areas to kind of optimize the network. And then I would also say reference-based pricing kind of falls into some of this. Certainly with the last legislative sessions that were very busy, there was a lot of legislative focus on reference-based pricing to Medicare, and a lot of plans exploring those types of arrangements, either in a limited capacity, like just for out of network, or just as a cap, or as a wholesale strategy in some more radical cases. But there's a lot of focus on networks and a lot of focus on out of network. We mentioned IDR, the IDR process already. I think that's caught a lot of people's attention. Sada, do you want to talk a little bit about digital health coaching and well-being services and what you're seeing in that space?
Yeah, happy to. Before I do that, I also want to add to the network strategies, what Eric mentioned, the narrow network strategies. In our opinion, and we've seen hard dollar savings that plan sponsors can realize. with centers of excellence and bundle payment services. Those two options, which are combined in many solutions, really yield good results because they are able to deliver hard dollar savings by having these bundle payment contracts and at a center of excellence. So it's a win-win to direct care into those facilities. Regarding digital health coaching and well-being services, these are again not new. Well-being services are really important for prevention aspects of things. We've been doing wellness in the industry forever, but now it has transformed into digital therapeutics. And we really like some of the point solutions that add value, especially the ones that are for mental health services. So like self-directed resources that use evidence-based modalities like digital cognitive behavior therapy, CBT, and digital acceptance and commitment therapy, ACT. These are two types of mental health therapies that can be delivered very effectively through this type of digital coaching. One more thing I want to add for narrow network is on-site clinics. By nature of having a clinic, it's essentially a narrow network because everybody comes to this primary care, advanced primary care center that you may make available to your membership. And then from there, care can be directed into further narrow networks like a COE or a bundle payment carrier. So those three things we really think work wonderful for medical cost management.
And then we couldn't go through a whole webinar without mentioning AI. So Jason, just as we keep things moving, so not taking too long to unpack everything, but we hear a lot about AI. There's certainly a lot of hype. There's a lot of discussion about it. What kind of things are we actually seeing within the healthcare space, and how is it affecting plans?
Well, there's definitely a lot to unpack here. There's no doubt AI is making its way into all areas of the healthcare sector. But there's a lot of promise from AI, in terms of smarter diagnostics, drug discovery, more personalized care, streamlining administrative tasks, things like that. I think in the short term, this is all going to be upward pressure on trend, adding to these high trends we're seeing. There's a lot of really steep implementation costs and training involved. So I think it is driving up costs, but it is it's a very exciting time in healthcare because of AI. And all of us on this call, we're either going to face cancer ourselves or know somebody that faces cancer. And it's really encouraging to hear, the promise that AI has in terms of, improving treatments, diagnosis, things like that. If you look at, a specific area like a physician office visit, we're seeing that as a big trend driver right now with no real diagnosis attached, just kind of a PCP visit. And one thing that AI is helping on that side, and I'm sure if anyone's talked with a physician, one of the biggest complaints they have is the administrative task, the fact that they have to document all this information from their patient while being present and integrating what's happened in past visits with that patient. It's very challenging. It's a lot of typing, especially for a doctor when they should be, performing other tasks. AI has a lot of promise in terms of, listening into that conversation, documenting it better, organizing that information. So that's being implemented now, and it's improving the care we're all getting. The challenge is that these systems are very expensive. So I think providers are kind of grappling with, how do we justify these investments, and how many more patients does a doctor have to see to offset that investment? And we are seeing more utilization. I think some of it is due to the improved efficiencies that AI is providing, but that comes at a cost. And I think we are seeing it. I don't know how much of trend is due to it, but I know some of it is. But it is very difficult data to capture. So it's, as definitely an exciting time, but there's a lot of challenges that it's presenting as well.
Yeah, it'll take some time for sure, either to be implemented or to show up in trend, I think. So moving on to some of the drug strategies. Some of this I think we've already talked about in answering some of the questions. But Matt, do you want to add anything around what you're seeing around biosimilar adoption, key considerations there, or also maybe this custom formularies? I know is a real hot topic.
Yeah, for biosimilars, I think, a big issue we saw, even though biosimilars have been around for over a decade, they're mostly mainly medical upfront. And then the ones that really, you would use through the pharmacy or things like insulin, so kind of a smaller overall impact. Those have been available maybe for 5 years or so now, maybe a touch longer. But Humira was really like the first big test that, was consistently contributed, 5 to 8% to a plant's overall pharmacy spend. But yeah, that was a real first big test, for the market in general. And it took about a year, before we actually saw any of the big three actually adopt biosimilars first. And once we did, we saw, exclusions of Humira, 100% biosimilar adoption, costs dropping rapidly. Humira was $8,000 a month, and we saw biosimilars dropping down to $2,000. We've got, sub $1,000 options available as well. So I think going forward for plan sponsors, it's really important to keep an eye on, is your PBM adopting biosimilars? Which ones? And how rapidly, right? I think the big three, at least for Stelara, which had its biosimilars first approved earlier this year, they're actually all on formulary as of July or so. But even though the big three have like their own manufacturers, it's important to remember that the white labeled option of CVS, Express Scripts, or Optum may actually not be the cheapest. Maybe they're 80% or 90% off, Stelara's list price. Maybe they're only 50% off Stelara's list price. So you've got to make sure that your members are going to the lowest net cost option, not just what you think the lowest net cost option would be, because inherently we would think that it would be the white labeled option to be the cheapest.
Thank you. And then, Saad, I don't know if you want to comment a little bit about GLP-1s or effective clinical controls, and then we can move right from that into obesity.
Yes, I will. So first, let me just talk about a little bit on the drug cost control for non-GLP-1s. So there are ways, like I mentioned earlier, about the step therapy for skin disorders, for eczema and psoriasis type of expensive drugs. So you can certainly do that. The other thing that we are seeing positive results from is shifting some of the site of care for oncology. So, for example, shifting oncology infusions from inpatient to outpatient, from outpatient to physician offices, from physician offices to ASCs, and then ultimately to home. They have all resulted in significant savings because just the simple administrative fee you can save on, and it's perfectly established and safe to do so. So that's one thing I can advocate for. Actually, if you just move on to the next slide, Eric, we can jump directly into GLP-1. So we all on this call, and there are several more at Siegel who nonstop talk about GLP-1s. And we have come up with many different ways that we can actually save on GLP-1 drugs. So what we actually particularly like is not just GLP-1, but managing obesity. And again, that's not new, right? We have been doing this in the wellness and disease management era since the whole industry started in terms of managing population health. And now I call that disease management 2.0, where we are managing these diseases. Obesity is one of them. By virtue of either digital point solutions or something to that effect. So we basically need to build the whole program around the person who wants to lose weight, provide them with coaching support, providing them with nutrition and fitness support. And you can manage that without offering GLP-1s directly. Restrict coverage for that and only save it for high-risk individuals over a certain BMI, but those who need to get it should get it. And the idea of these programs, the wraparound programs around obesity management, is to prevent people from getting GLP-1s if they really don't qualify in terms of their BMI metrics. Again, negotiating lower prices by selecting a GLP, that's one thing that we have been talking about. You can grandfather some of the drugs and not approve the new ones that are coming or get better pricing. Or there are some of our clients who do not cover GLP-1s for anti-obesity, but they do encourage members to enroll into the program to lose weight, and then direct the members to LillyDirect and NovoDirect, where they can actually directly obtain the GLP-1 drugs. So with that, I think I'm going to just move into the last slide because we don't have much time left. So here is the Siegel's health consulting approach, right? Starts with data, and then we do all of the three things that are listed here. population health management data is the basic of that. There is no magic bullet in managing claim cost, but we do recommend this balanced three-pronged approach to effective healthcare cost management, where data analytics is an essential function. Every plan sponsor is different. Many plan sponsors use data to identify what's working. The other core purpose is to fix an economic problem with healthcare costs. Data analytics can uncover many plan design inefficiencies and vendor contracting inefficiencies, meaning how well the vendor is performing, who is monitoring the ROI, who is monitoring the performance guarantees. So basically, we can use data to measure population health management and how well we are doing that. And then more and more plan sponsors, as we see, are taking matters into their own hands, taking bold steps in order to contain costs, meaning negotiating direct contract prices, setting up their own network. On-site clinics is a great example of starting with a on-site physician or near-site, whatever you want to call it. And in some cases, building parallel health systems, meaning referring patients only to certain networks which are vetted for centers of excellence and with which they may have better contracts, either through a bundle payment solution or something through their direct efforts. So we really think data is the foundation of all of the consulting that we do. And that's what we advise here as well. And with that, we can take, we have time for Q&A.
Let me put this up for everybody. We don't really have a whole lot of time left, but I want to say we got a lot of questions in advance about ICHRAs. So I wanted to at least address that. And so ICHRAs, if you're not aware, is essentially tax-free money that you can give to your members for them to buy individual plans. And this has gotten a lot of growth recently. I think it's up to about 500,000 people, maybe more now, are covered under ICHRAs. But I don't think and I think this is kind of one of the key questions, there's not a lot of large employers that were offering coverage before that are dropping coverage and moving to ICHRAs. Most of the growth in an ICHRA is coming from either small employers, and I think particularly from employers that weren't offering coverage before and started offering have started offering coverage through an ICHRA. So I don't think we've really seen a lot of traction in the traditional large group market yet. It's hard to see it's hard to say where things will go with really high trends. Anything is really, I think, possible. I think we're at time here.
We can, there's a few others we can address quick. Yeah, sorry, we got a lot of really great questions, a lot of good engagements, really good to see. One thing we will do is we will follow up afterwards to address any questions we don't get to. One of them I want to address quick was in regards to what's contained in our survey data. So what we do is we survey a variety of PBMs, TPAs, and managed care organizations. There's approximately 70 health insurance providers and other healthcare management organizations that participate in the survey. And in total, the respondents represent about 80% of the commercially insured and self-insured market. So hopefully that answers that one. We got a few on gene therapies. I don't know if we wanted to just make that our last one and then we can follow up with the rest, but that seems to be a popular topic in terms of, what are some strategies for covering? Do you feel invested in gene therapy specific stop loss is a wise investment? I can certainly address part of that. I don't know if Sana, you wanted to have any closing thoughts here on gene therapies at this time?
Yeah, so we do, if, of course, plan sponsors have the option of not covering gene therapies. But then it's going to be harder and harder for you not to cover because more and more conditions are going to have gene therapy options. So it might become hard. So if you cover gene therapy and if you are of a certain size, so if a large client, they can probably cover it because you pool your risk across population. But for small clients who are covering it, we strongly encourage having a stop loss option or a gene therapy specific carve out stop loss option. And there are many, many options that are emerging that we are on top of right now.
Yeah, I guess I'll just add to that. Like I wouldn't call it an investment, a gene therapy stop loss policy. It's really more of a budgeting tool. And yeah, like Sana said, if you're a smaller employer, it's definitely something to consider. These are coming to market for a variety of conditions, especially cancer. The costs are coming one way or another. If you're not in a position to absorb a $1, $2, $3 million claim even, it's definitely something to consider. But that takes us at time here.
Yeah, I think we'll reach out. We'll reach out with some other ones. We'll have Jason will personally call you with an answer. But otherwise, thank you guys so much for coming. We hope you found this interesting and taken some value from it. And certainly download the full report. Has a lot of information that we did not get to in this call. So look at the full report when that comes out. At the QR code here below. And have a great rest of your day.
Thank you, everybody.
And thank you.
Bye-bye.